thank you so much for joining us today. We're excited to talk with you. Um, First things first, we'd love to just learn a little bit about yourself, what your role is, and where you're from.
Yes, I am a gastroenterologist in Los Angeles, Century City area. I have finished from UCLA GI fellowship, and I have been in practice for almost 25 years now.
First things first, we would love to learn a little bit about what drew you to having a conversation with us in the first place.
Um, I think it's a very useful and easy to bring into a practice technology, and it has definitely made a difference in my workflow and my staff workload. I believe it's a very reasonable consideration for GIs who want to add that small bowel endoscopy aspect into their services.
That makes a lot of sense. So, talking about the exploration of the small bowel, as you know, CapsoCam has 4 cameras offering a 360-degree panoramic view of the small bowel. What impact have you seen from perhaps competitors with a single lumen view versus the 360-degree panoramic view that CapsoCam has when diagnosing the small bowel?
It's definitely easy to miss, even with dual view cameras, as long as their projection is more like 180 to 270 degrees at best. So it's easy to miss lesions, especially in curvatures or behind folds, or in cases that there's a lot of debris or bleeding. Sometimes you can miss it. So of course you can miss things even with this technology if you don't have the appropriate prep for the patient, or there's a lot of bleeding or other factors. But at least it gives you as complete a view of the entire gastrointestinal mucosa of the small bowel as possible. The quantity of the images is staggering, and the quality is very good as well.
Talk to me a little bit about what the workflow looks like with CapsoCam versus perhaps in the past with other capsule endoscopies.
Yes, it's definitely much easier and made a big difference, and especially since it came during the pandemic when we were, limiting the exposure of staff to patients and vice versa. It allowed for a seamless experience. The staff can input the information in the workstation and have the capsule initialized and ready to go with the patient. The patient could even do it on their own or even potentially remotely. So that helped a lot instead of having staff spend a lot of time initializing the device and then putting the belt on the patient and the other associated equipment that comes with it. Also, the patient is not tethered to anything, and it's much easier for the patient to go around about their day. All they have to do, of course, is monitor their visits to the bathroom in order to be able to capture the device. I think overall, compared to the previous way of doing things, has decreased significantly the workload to my staff and also the ease to the patient.
Perfect. Thank you for explaining that so eloquently. So the staff doesn't have to worry about scheduling, rescheduling, belt returns or anything along those lines, and they're not dealing with having to download the data from the device as some other competitors do. So I appreciate you sharing the differences between the workload with CapsoCam versus other competitors.
Yeah, and also the return part, because it's so easy to be done via, FedEx envelopes.
Yeah.
It really frees the patient. I have given it to patients who were traveling, and otherwise it would have been impossible to come back to the office the following day to bring the belt with a recorder.
Right.
So they can FedEx it from their destination, from a different continent potentially. And I had some patients who did that overseas. So that was so much more convenient and, able to assist a lot of patients, especially the ones that are busy and running around and, they want to minimize their time
Right.
for these procedures.
Well, and they can carry on with their day.
Exactly.
They can carry on with their day, and your staff can carry on with providing
day.
addition. Yeah,
Yeah,
exactly.
go back to insurance authorization and
Yeah.
verification part.
Right, which we support with, right?
Absolutely.
Definitely. So the workflow, the patient experience, and then of course the clinical differences. You mentioned the patient being able to return the capsule from any other continent or anywhere in the world, frankly. What I thought about in that moment was your ability as a physician to read the study from anywhere. So before we jump away from the workflow entirely, I know you currently utilize our reading service. So tell me a little bit about how the reading service has impacted your ability to help diagnose patients and just run the capsule endoscopy program in whole.
Yes, that is also a significant improvement to my workflow. And, having done the reading the hard way in the past, I can attest to how easy it is to just get the report. And of course, you can always review the images yourself. The report comes out in a very comprehensive format with multiple images annotated with the reviewer's comments and findings. And you can always go to the raw data, the raw images, and review it yourself in cases that you have additional interest or suspect something different or what have you. So
Right.
it definitely gives you the flexibility to, not spend 2, 3, 4 hours reading the capsule. And then if you need to, go back and re-review it yourself if you want to have the added confidence in the diagnosis.
From anywhere in the world.
Correct. You can go to the workstation and you can access, review, and analyze whatever you need.
Right.
And you have everything over there, which is very useful, and it definitely saves time and headaches.
Right. And so you mentioned that if you do have a question about the report, first things first, you yourself can go and investigate by studying the video and images yourself. Or we also have the doctor's contact information on the report for you to speak with the reading physician directly.
Correct.
Then we move on to the clinical impact. 96% completion rate for our studies. What does that mean for yourself and for patients when we're looking at competitors that have 86 to 87% completed rates? How significant is a completed study for you as a physician when you're putting these patients through their procedures?
Yeah, of course, it's extremely important. And, every time that there is an issue with procedures or delays or cancellations or inadequate data capture, it's a problem. And, obviously you always try to have a good rapport with your patients so you can explain to them exactly what happened, but not having to do that definitely removes a big headache from your day.
Right. Totally. Thank you for sharing all this information with us. It's incredibly helpful. One thing I would love to hear from you is if you were talking to a fellow gastroenterologist anywhere in the world that's very familiar with the traditional capsule endoscopy systems, those single lumen views, belt recorders, what would you say to them to pique their interest or to basically, for lack of a better term, in one sentence, explain why CapsoCam has been worthwhile for your practice?
Well, I would say imagine how many more patients' small bowels you will be able to evaluate at the same time that you would be spending reading one capsule endoscopy with a traditional system.